This PowerPoint presentation is on buprenorphine by Sonia Strunk, Aspen University, Neurobiology of Addiction. The overview of buprenorphine. Buprenorphine is also called Suboxone, is a semi-synthetic opioid that is derived from the thebaine, which is an alkaloid of the papaver somniferum. Buprenorphine is administered in an office setting and is usually given to the patient to take home and administered on their own. Buprenorphine is an opioid partial antagonist. What this means is that even though buprenorphine is a true opioid and may yield characteristics of opioid effects as well as certain side effects, for example, the user may feel a euphoric feeling and may cause respiratory depression. Its maximum effects are much less than that of a full agonist, such as heroin and methadone. When administered at a low dose, buprenorphine will produce ample agonist effects to allow the opioid-addicted individual to stop the misuse of the opioids without feeling withdrawal symptoms. The chemical name for buprenorphine is C29H41NO4. Buprenorphine is also sometimes called Subutex, Suboxone, and Buponex. There's much debate over medically assisted treatment. Many people believe that this is trading one addiction for another. Others believe that this is harm reduction and allows the addicted person to live a life free of substance abuse. In the following presentation, I will provide information to both sides of this debate. The pros of buprenorphine. Buprenorphine, when used correctly, will reduce opioid cravings and relieve withdrawal symptoms. This will allow the patient to remain in treatment and regain control over the opioid addiction without the disturbance of cravings and the anxiety of withdrawal. While the patient is in buprenorphine treatment, there is no need to be hospitalized. It offers a discreet way to treat opioid dependence while in a physician's office with privacy, confidentiality, and safety. Also, buprenorphine treatment will allow the patient to continue on with daily activities such as work, family, and life without daily trips to a clinic to receive this medication. Buprenorphine has what is called a ceiling effect, where the agonist properties of buprenorphine will rise linearly with higher doses of the medication until it will eventually reach a plateau and will no longer increase with more increases in dosage. What is good about buprenorphine is that it will actually block the effects of a full opioid agonist such as methadone and heroin, and will also participate withdrawal symptoms if given to an opioid addicted person while a full agonist is in the bloodstream. Meaning if they have heroin in their bloodstream, buprenorphine will actually put them in complete withdrawal. That's why before going into an office to be prescribed this, they're asked to remain 14 hours off of any opioids. More pros. Buprenorphine has increased the number of agonist-based treatment methods that are available to treat patients with opioid addictions, as well as offers the HIV community and HIV care clinicians an opportunity to address opioid dependence with each other. Empirical evidence collected over 20 years has provided strong support for buprenorphine as an effective treatment for opioid dependence. Many primary care physicians who treat opiate addictions with the use of buprenorphine treatment have been plagued with individuals who suffer from not only opioid addiction, as well as chronic medical issues and mental health issues. Research has shown that ethnic minorities that have both mental health issues as well as substance abuse tend to rather access health care from a primary care setting. This will allow for better cohesion and collaborated care within the community. HIV-positive patients that suffer from opioid dependence are also likely to benefit from the mixture of buprenorphine treatment, not just for reducing opioid use, but also increasing both the initiation or maintenance of antiviral treatment and may improve CD4 counts. Buprenorphine treatment has also been associated with diminished injection drug use as well as lowering HIV risk behaviors. More pros. There has been much evidence that supports the many benefits of buprenorphine, constructed on the framework that continues to support individualized recovery, especially when in relation to the approaching technique of rapid stabilization and flexibility that would allow transition to other treatment modalities or achieve abstinence altogether, which would work towards the effectiveness of stopping the use of illicit drugs, as well as the treatment of comorbidities through drug and drug interactions, along with good safety profile in a treatment plan. Buprenorphine, when combined with an opioid antagonist, naloxone, is said to strengthen recovery-oriented systems because of its potential to reduce misuse and diversion. The progress from addiction to recovery and the ability to maintain recovery will depend on the individual's needs, the goals set in treatment, the amount of recovery that the individual has developed. A successful buprenorphine treatment facility will consist of monthly visits with a physician, weekly one-on-one counseling sessions, resources to aid one's recovery and self-help meetings of the patient's choice, frequent drug testing, and they will also have a system in place to reduce diversion from the medication, and a higher level of treatment, such as an intensive outpatient program for individuals that require more intense treatment. Successful buprenorphine treatment will aid in reducing compulsive behaviors, stop constant cravings, hinder drug use, and maintain a safe, abstinence-free lifestyle. When all of these symptoms of substance use have diminished, professionals believe this is remission from active addiction. Buprenorphine is said to still maintain some of the pre-existing physical dependence of drug addiction, although much of the physical dependence is easily managed medically and will eventually be resolved with a slow taper off buprenorphine when the patients feel as if they are ready. Physical dependence on buprenorphine, unlike addiction to illicit substances, is not a dangerous medical condition that would require inpatient treatment. Addiction is a destructive and may be life-threatening, while physical dependence on such medications as buprenorphine may be inconvenient, but is nothing that is compared to an individual who takes large doses of opioids for an extended period of time. When a patient makes a change from addictive opiate to successful buprenorphine treatment, the addictive behavior of the individual often stops. This has much to do with buprenorphine's long duration of action. Physical cravings stop prior to taking this medication. Their drug-seeking behavior is said to end as well. The patient will eventually regain control of their lives. With that being said, most of all the hallmarks of addiction disappear with successful buprenorphine treatment. The cons of buprenorphine treatment. Many patients will state that while taking buprenorphine, they feel normal. Buprenorphine is said to have a powerful pharmacological effect. Buprenorphine will attach the mu-opioid receptors in the brain and body and deny access of any other opiate molecule, which could be dangerous if someone was in a car accident or needed pain medication. This would block the effect from it actually working on them. When a patient abruptly stops taking the medication or has to have a rapid taper off the buprenorphine, it will then produce almost all of the typical unbearable opiate withdrawal symptoms. Symptoms such as sweating, nausea, muscle spasm, restless leg, flu-like symptoms, and insomnia, depression, gastroenterological upset, anxiety, and mood lability. Patients should not assume that buprenorphine treatment guarantees a fairly easy detox down the road, or that they should not believe that buprenorphine withdrawal is substantially different from any other opioid withdrawal. Buprenorphine is addictive. There are some individuals who develop the dangerous, uncontrollable compulsion to use buprenorphine. Federal regulators have recently acknowledged that there are some users that are injecting the crushed tablet to get high, and it has been shown that there is existing a flourishing street value for this drug. It has also been noted that some doctors seem to be prescribing the drugs outside of the bounds of good medical practices. Many users, without the intent of becoming substance-free, may find physicians for a fee will give the patient a 90-day supply of buprenorphine without the appropriate care that is needed for this medication. Subutex is buprenorphine without naloxone. The naloxone is a safeguard, which is primarily used to treat pregnant women. Has a higher level for abuse because without the naloxone, it can be injected. This decreases the onset time and increases the euphoric effects that will increase the potential for abuse. In 2000, Congress passed DATA 2000. This is a law that would allow physicians to become qualified to prescribe FDA-approved opioid-based medications specifically for the treatment of opioid addiction. Buprenorphine with naloxone, also called Suboxone, and buprenorphine alone, called Subutex, would be the first two medications to be FDA approved and affected under this law. If a physician takes an 8-hour class and passes the test, they become eligible to apply for such a special waiver that would allow him to treat addiction with this medication. This same law does not have any supporting evidence that will add a cap to the number of addicted patients that a physician can treat. For the first year, the physician can only treat 30 opioid-addicted patients, and the following certification, they may add 100 more. This is the only medication that has such a stringent restriction that hinders physicians from wanting to prescribe this medication. Not even medicines like OxyContin or highly addictive medications have such a restriction on them. Buprenorphine detoxification can be more effective than non-opiate treatments for dismissing opioid withdrawal symptoms and keeping patients in treatment. Nevertheless, it has been proven less effective than buprenorphine maintenance treatment. Detoxification could be recommended for patients with good predictive factors who may not want or need maintenance treatment. Detoxification should, in many cases, be immediately followed by addiction treatment program, and by itself is unlikely to be effective. Patients should be warned that they quickly lose tolerance with abstinence and can overdose if they relapse to heroin or methadone. Many pharmacological interventions for opioid addiction are highly effective, although when looking at the complex biological, psychological, and social aspects of the disease of addiction, buprenorphine must be accompanied by appropriate psychosocial treatments. Clinicians must be aware of the neurobiology basis of opioid dependence. It is important for information sharing with the patients and can provide insight into patient behaviors and problems and clarify the rationale for treatment methods and goals. The summary. As with any treatment modality, it is important to understand the needs of the patient. One must look at the socioeconomic status of the patient, social and living environments, family and genetic factors, job and legal situations, social and recovery support, years of use, the number of times in treatment, to decide what level of care is most appropriate. For instance, if a patient has a job, a family, strong social support, buprenorphine treatment could be possibly used for this treatment. If a patient does not have a job or stable housing, legal situations are high and a high rate of relapse, buprenorphine treatment may not be the best practice for such a patient due to the high risk for diversion, high potential to sell their medication, and not take their medication appropriately. It is my opinion that if prescribed correctly with the appropriate education of the patient, clinician, and patient, buprenorphine could be extremely beneficial treatment modality for an individual who meets the criteria for medically assisted treatment. It is important to find a reputable physician who is committed to patient care and education in the field of addiction. Treatment has been known to allow patients to stabilize their lifestyle with the withdrawal symptoms and behaviors associated with opioid addiction. Here's my reference page. And that is the conclusion of this PowerPoint presentation.